This presentation is a joint collaboration between Heart Research Australia, specialist staff from Royal North Shore Hospital and North Shore Private Hospital to provide you with important information about your cardiac care.
There are more than 8,500 deaths in Australia from a heart attack. That's a staggering 23 deaths a day, or 1 an hour. Unfortunately, around half of these deaths occur before patients get to hospital or meet first medical contact. There are more than 50,000 admissions to hospital each year with heart attack. At the Royal North Shore and North Shore Private Hospital, we see 20 patients a day in the emergency department with chest pain, of whom 4 have completely blocked arteries or a heart attack. A heart attack is sometimes called a myocardial infarction, or a coronary occlusion, or a coronary thrombosis. A heart attack happens when there is a sudden, complete blockage of an artery that supplies blood to the muscle of the heart. The heart can pump up to 10,000 litres of blood a day, and for this it needs energy that is delivered to the heart by the coronary arteries. As we get older, the smooth inner lining of the arteries becomes blocked or narrowed by plaque. When an area of plaque breaks, blood cells and other part of the blood stick to the damaged area and form a blood clot. A heart attack occurs when a blood clot completely blocks the flow of blood through the artery, and the heart muscle then begins to die. The patient becomes aware of the symptom, usually a tightness or a heaviness in the chest. The longer the artery is left blocked before it's treated, the more damage is done to the heart muscle. Time is absolutely crucial. Each patient experiences a heart attack differently. Although chest pain is a typical symptom, many patients describe only a feeling of pressure or tightness in their chest or jaw or neck. Indeed, many patients report that the pain they experience is not so severe they don't immediately realise they're having a heart attack. The pain may radiate to the arms or the throat or through to the back, or even be felt in the stomach region. Some patients experience nausea and vomiting and sweating as the only symptom of a heart attack. Some may just collapse. It's important to call for help, specifically to call for an ambulance. So what happens when you call an ambulance? At the Royal North Shore and Westmead hospitals some years ago, we helped pioneer a method of field triage. What happens there is that the ambulance officers perform the diagnostic test for a heart attack, which is called an ECG. That ECG has a certain pattern which can be immediately identified as showing a heart attack. The ECG signal is then sent via the internet to the hospitals, and the patients are then transported directly to a hospital which can deliver appropriate care. In a big city like Sydney, this care involves bringing the patients to an operating theatre where the arteries can be opened by a technique called coronary angioplasty. The sooner this can happen, the better. When the patient is being transported to the hospital, we have a team of specialists on call who can arrive at the hospital as the patient's arriving in the ambulance. The clinicians meet the patient in the laboratory, and the treatment can be then delivered with the minimum delay in time. This type of emergency procedure reduces the time to treatment of heart attack by about 100 minutes, and this saves heart muscle and reduces the likelihood of dying. In rural and remote Australia, or even in urban areas where cardiac catheter laboratories are not within easy reach of the ambulance's travel time, ambulance officers are now able to deliver clot-busting therapy at the scene of the patient's home. This then offers the patient the best opportunity of saving the heart muscle before the patient can then be taken to a catheter laboratory for further treatment. An angiogram is then performed to identify the blockage in the artery. During this procedure, the cardiologist will insert a small flexible tube into the artery, usually through the wrist or sometimes through the groin. And then images will be taken of the arteries by injecting iodine dye through into the vessels. The iodine is then identified with an X-ray machine. The blockages can be identified, and then the artery needs to be opened. This is done by the passage of a very small wire about the diameter of an eyelash, which is then carefully passed through the blockage. A balloon is fed over this wire, and then when the balloon is placed where the blockage is, the balloon is inflated. When the artery is then opened, the blood flow is restored, the ECG changes, which the ambulance had identified, are reversed. The patient usually feels immediately better once the ECG changes have resolved. The job is not finished. The first balloon is then removed while the wire is left in place. A second balloon with a little metal stent compressed on the outside is then placed at the point of the blockage. The cylinder-shaped balloon is then inflated again, and the stent is then compressed and expanded against the wall of the artery and matched very accurately to the size of the patient's blood vessel. Complex medications are then needed in order to prevent clot formation on the stent. Remember, the stent is metal and the body will tend to reject metal, so we give medication to prevent blood clotting. With rapid hospital presentation and state-of-the-art treatment to open the artery quickly, many patients will have minimal or no complications of their heart attack and feel so well that they want to leave hospital immediately. The average stay in hospital with this sort of treatment of a heart attack is about 3 days. If there have been long delays to treatment, many other complications unfortunately can happen. Some of these are fatal unless treated immediately. The longer the artery is blocked, the greater the damage to the heart muscle. This reduces the heart's ability to pump the blood, can cause fluid to build up in the lungs, can lower blood pressure and cause poor blood flow to vital organs such as the kidneys. This is known as heart failure or even cardiogenic shock. All patients require a holistic approach to their treatment and recovery. Our nurses and education teams see the patient immediately after the heart attack, usually the next day. It's very important to get the message of prevention across to the patient. The doctors also adjust many of the medications required before the patient is discharged. Each medication has a specific role, either to prevent clotting, lower cholesterol, protect or improve the healing of the heart. Often 5 or 6 drugs are needed in combination when people leave hospital after a heart attack. After leaving hospital, the patients are offered the opportunity to attend cardiac rehabilitation sessions where they attend with a group of other people. They receive education, they learn about the mechanisms of heart disease, the best way of avoiding a recurrent attack, as well as getting back to normal active life. Improving community awareness is critical in reducing heart attack deaths. Although ambulances will come quickly and often be able to deliver a heart attack patient straight to our catheter laboratory to have the artery unblocked, this can only be implemented after the patient calls for help. Many of the deaths occur because no help is sought. Knowing the warning signs of a heart attack and acting quickly by calling 000 can reduce the damage to your heart and increase your chance of survival.
Heart Research Australia was established in 1986 by cardiologists at the Royal North Shore Hospital who wanted to reduce the high death rates from heart disease. The foundation supports seed funding for researchers to test innovative new ways to prevent, diagnose and treat heart disease. During your treatment, you may be asked to participate in one of the research studies conducted by our academic cardiologists and their teams. We encourage you to consider this, as cardiology is one of the most rapidly advancing fields, and improved treatment of coronary artery disease through research has the potential to save many lives in the future. For further information, please visit the Heart Research Australia website.